Hey, welcome and thanks for joining us for our annual 2021 Compliance Supplement Update. I am Joy Feige. I'm an assurance partner in the Sioux Falls, South Dakota office. I primarily specialize in the nonprofit industry with an emphasis in auditing financial assistance. I'm also the chair of the Single Audit Technical Issues Committee for Eide Bailly. Joining me and helping me out is Kurt Slicker. He is an audit partner in our Reno, Nevada office. Kurt specializes primarily in the governmental industry and is also a key member of our Single Audit Technical Issues Committee. He is responsible for putting together a lot of our training materials and writes a lot of articles that we share on our Eide Bailly website. So again, thank you for joining me today. And with that, I will just touch on what we're trying to accomplish today. So we are going to be talking about the key changes in the 2021 OMB Compliance Supplement. The Compliance Supplement is a guide that's relied upon by auditors, and it kind of communicates to the auditors the OMB's expectations on what an audit of the federal assistant should consist of. However, the Compliance Supplement is also a very useful tool for auditees and recipients. It gives you basically an understanding of what the federal agencies deem to be most important relating to specific financial assistance. With the onset of, or since the onset of the pandemic, the COVID assistance coming from the government in multiple different directions has created both accounting and auditing challenges for all of us. I'm sure we're all well aware of the difficulties. So today we're hoping to answer a few questions that you may have relating to the COVID assistance and add some clarity. We're also going to be covering lessons learned in the past year from the CARES Act testing, and then talking about challenges ahead with the American Rescue Plan Act, or ARPA. Okay, so for those of you that are not familiar with where to find the Compliance Supplement, Amy is going to include the link in the chat. And so you might want to have that open on a second screen. It is organized by parts or appendixes, which we're going to be referring to throughout the presentation. So might want to click on that link and get it open if you're not familiar with the Compliance Supplement layout. The Compliance Supplement was released in mid-August. It is effective for fiscal years beginning after June 30 of 2020. We do know that we are expecting a follow-up addendum or potentially two addendums this year. It will be similar to last year, where the addendum came out around Christmas time, I believe, last year. We're unsure of the timing at this point of when we're expecting those addendums. So we are really just in the waiting mode relating to the addendums. We are told that those addendums will be posted to the CFO.gov website. The layout of the Compliance Supplement is organized very similar to prior years, so no big changes there. The current supplement that was released does provide details for some of the COVID programs, which we'll be walking through today. And then some will be supplied in the addendum, which again, we're kind of in the waiting mode for those. And so the first place that you should really look is Appendix 5. Appendix 5 is really a high-level snapshot of what has changed since the 2020 Compliance Supplement. So it helps you to identify that there is a change. And then once you have identified a change, you would need to then go to the various parts of the addendum where that is covered to understand the specific changes. So there's been several changes in the programmatic changes. The terminology has changed. So now it's referred to as assistance listing number. Formerly it was a CFDA number, so don't be confused by that. It's really the same thing, change in terminology. And then what part of Appendix 5 does not do, it does not include the changes that are in the matrix or Part 2 of the compliance supplement. So it's very important to review Part 2 to identify what has changed. And again, for those of you that are new to single audit, Part 2 is really a matrix, and it's a grid that lists across the top the compliance requirements themselves, and then down the side it has the financial assistance listing numbers, which are covered specifically, and the 6 requirement mandate still continues to be in effect. It's actually 7 for the research and development cluster. But what was implemented, I believe it was 3 years ago, is that in order to reduce the burden, they have indicated that the agencies really only need to pick 6 that they want the auditors to really focus on. And those are the requirements that the auditors should be testing, assuming they are applicable to your grant. The changes or significant changes in Part 3 really have to do with the uniform guidance changes. And as a reminder, some of the uniform guidance changes were effective on August 13th. There was prohibition on certain telecommunication and video surveillance services vendors. And then the other revisions were effective after November 12th of 2020. And so Kurt's going to be covering the uniform guidance changes in further detail in a few slides, but really the challenge is that some agencies have adopted the uniform guidance and some have not. And so paying attention to whether your agency has adopted the uniform guidance is really important key takeaway. What I think the most important change is relating to Part 3 relates to both performance reporting and special reporting guidance. And Kurt is going to be covering the special reporting on FFATA reporting, but just a couple words on the performance reporting. So performance reporting is an increasing emphasis by federal agencies where they're asking to demonstrate the effectiveness of what you've done with the federal assistance and making sure that the grant purpose is being accomplished. And so they have identified in Part 4 and Part 5 key line items that they would like the auditors to test. And they've given us some clarifying guidance that if that information is not quantifiable or capable of evaluation against objective criteria, then the auditor is not required to test that information. If they have not designated key line items, then we are only required to test that the report was submitted timely and no other procedures are required. And so this key line item really is only applicable for the financial assistance listing numbers that are included in Part 4 and Part 5. If your grant or assistance is not included in Part 4 or 5, the auditor is still needing to use their judgment on which line items to test relating to grant reporting. Significant changes in Part 4 are really across the board and are really the result of what has happened in the world since the March of 2020 date and all of the different assistance that has been rolled out. The other things are really a result of the uniform guidance changes. And so part 4 is just the program changes and the impacts. We're going to be talking about which programs had significant changes versus which programs maybe didn't have as significant changes. So part 5, there's been minor changes in the research and development cluster. The student financial aid cluster did include some additional guidance. So I believe it was 2 years ago, the auditors were required to submit to the Department of Ed some information on the sampling information that we had used when we performed a student financial aid audit. We are told that the Department of Ed is working on a standard spreadsheet for the auditors to use in which to submit that information. And so more information to watch out for from the Department of Ed if you're an auditor and need to submit that spreadsheet. There's been some other changes in earmarking relating to waivers on community service requirements, but it had 2 significant changes in the special tests and provision area relating to whether aid needed to be returned when a student stopped attending due to COVID, and then additional testing when student has credit balances due to Title IV. There's been some other minor changes, so I would encourage you to read through the special test and provisions section of the student financial aid cluster if you are responsible for either implementing or auditing that audit program. Also in part 5, there were some other changes to clusters. So they removed the food aid donation cluster entirely. They added a program to the child nutrition cluster, and then a new cluster with the Department of Transportation in the motor carrier safety area. So this is a slide intended to give you a visual and just kind of give you an understanding of what we're hoping to cover today. So on the left-hand side of the slide, you would want to refer to the compliance supplement for some significant changes in those programs that we're not necessarily going to dive deep into today. On the right-hand side of the slide, Kurt is going to talk about ESSER and HERF through the Department of Education, the CARES Relief Fund through the Department of Treasury, and then I'm going to be covering some provider relief funds, Medicaid cluster, and HRSA programs through the Department of Health and Human Services. So with that, Kurt, do you want to talk us through this concept of higher risk designation by the federal agencies?
Yep, I would love to. And Amy, if you can switch control over, that would be great. Okay, so as part of the compliance supplement this year, there was Appendix 4 coming out and this concept of higher risk designation. Now, higher risk designation has always been a thing. It's always been there. It's always been a step in major program determination for the auditors that are listening. But for the auditees, you know, this concept has always lived there, but historically, it's really just been Medicaid that was listed as higher risk. Medicaid is 99 times out of 100 tested at a state level. The higher risk designation for it is due to the complexity of Medicaid and testing that program at the state level and its dollar amount and everything else. Well, OMB and the various agencies, whether it was Department of Ed or Treasury, when they started looking at this higher risk designation, they realized that a lot of these CARES Act programs and these other all these COVID programs, right? There's CARES Act, Families First, you have the Supplemental Appropriations Act, American Rescue Plan Act. All of this funding came out in a very short time frame. It came out, roughly in about a year's time. The requirements were changing. For everyone that was monitoring in real time, it seems like we had frequently asked questions on an almost weekly basis. They would change their mind, they would issue other guidance. You had OIG issuing guidance, you had the agencies issuing guidance. And so really, they came out and said that the COVID-19 programs are also going to be designated as higher risk. And in addition to the COVID-19 programs, some existing programs that got a lot of supplemental funding in relation to COVID-19 would also be designated as higher risk. And don't worry, we're going to cover what higher risk means and the impact, but that's kind of the background on what OMB was thinking and what the various federal agencies were thinking of. Just a lot of funding came out, a lot of regulation, a lot of back and forth, a lot of FAQs, and there's just so much information, and the auditor really needs to pay attention to make sure they get it right. They should be auditing these programs. There's a lot of oversight or emphasis on these programs. Everybody wants to know, is there fraud in the CARES Act? What's the fraud like? What's the misuse? What's the abuse? All of that type of stuff. And we're not necessarily auditing for fraud, waste, and abuse, but we are auditing to see, if there's compliance with direct and material regulations. So here are the programs that have currently been identified as higher risk, and there is one very large asterisk on this. The compliance supplement that was released that has been provided in the chat and Joy was just going over, that did not include American Rescue Plan programs. It only included CARES Act and up through the Supplemental Appropriations Act, and Families First and all of that stuff was included. But as far as the major acts, it has excluded the American Rescue Plan. And when we get to the addendums and what we expect in the addendums, that's where we're going to bring in the American Rescue Plan programs and talk about that. I am certain that or not certain, but I'm sure that many of those programs will also be designated as higher risk. But in the current compliance supplement that is published, that is available to us, we have Medicaid, which again has always been higher risk. The Provider Relief Fund, Joy will cover that later, and the testing on that and the requirements of that. Testing for the uninsured. Here's kind of what I was talking about with a supplemental impact. The Airport Improvement Program, it's been around for many, many years, but the Airport Improvement Program did receive quite a bit of supplemental funding through the various COVID-19 legislation and acts. And so the feds have identified the Airport Improvement Program as a high risk program. Same with the transit cluster. Again, that's a supplemental funding issue. It's not that that's a new program under COVID-19 legislation, but that they received a lot of supplemental funding. The Coronavirus Relief Fund, or CRF, that obviously is a newly created program that was under the CARES Act. Emergency rental assistance. Now, this program, it's deemed higher risk, but then it's kind of weird because it's not in the compliance supplement. Why they did that, nobody knows. But again, the AICPA is questioning and pushing for inclusion of the emergency rental assistance in an addendum. Not sure if that will happen or not. It was more of the case of you designated this program as higher risk, but then didn't include it in the compliance supplement. So that just seems a little odd and strange. Please provide guidance. And so No idea if that will come out in an addendum or not. That's just the ask and the push currently. And then the Education Stabilization Fund, which, you know, whether you're K through 12 or higher ed, you may be thinking of it as ESSER or HERF. Those are the common acronyms that are thrown around, but one's essentially elementary education and the other's higher education, but they're both under the Education Stabilization Fund umbrella, which is 84.425. And again, the ARP programs are being compiled by OMB and hopefully will come out in an addendum. Not sure how many will be in that addendum. You know, we're waiting and seeing, just like everyone else. Okay, so what does higher risk mean? For the new American Rescue Plan Type A programs, essentially, I'll be honest, doesn't really change a whole lot because you wouldn't have audited them in the prior 2 years, right? They're new programs that are effective this year. And if they're type A program, meaning they're a large enough program to trigger into a type A, because I realize not everybody's an auditor that's listening to this. So for the clients that are listening, or for the entities that are listening, you know, essentially we break programs out into type A programs and type B programs. Type A programs are larger. It depends on the dollar amount of your schedule of expenditures of federal awards. But type A programs are larger programs and type B are the smaller programs. The type A programs, they have to be audited at least once every 3 years. And so if you have an American Rescue Plan program that's type A, it's new, we wouldn't have had audited it previously, so it's going to be required to be audited. For the non-American Rescue Plan Type A programs, so if we think about, you know, the CRF, which was the Coronavirus Relief Fund, or Airport Improvement Program, or the Transit Cluster, those that I just kind of went over on the previous slide, we pretty much think that in most cases, it will result in the programs requiring to be audited in the current year, even if you audited them in the prior year. And the reason is the compliance supplement outlines a couple of criteria that must be met to classify them as low risk. So the program would have otherwise had to meet the low risk criteria. So you would have had to have audited it within the last 3 years, and there could have been no material weaknesses or material non-compliance. They had to have had no significant changes in systems or personnel. Okay, so they would have had to meet that criteria. And then the percentage of COVID-19 funding in the program is not material. Now, each auditor determines materiality. That's based on their own kind of risk. But, you know, as a general guide, COVID-19 funding and materiality is gonna, you know, I would say 5% is kind of a baseline for that. So if your program received more than 5% of COVID-19 funding, Airport Improvement Cluster, the Transit Cluster, et cetera, then likely the auditor will conclude that it's material. And then if it's material, regardless of it meeting low risk criteria, will still be required to be audited. All the CARES Act programs, well, those are all new programs that got stood up as a result of CARES Act. So obviously the COVID-19 funding is material for that. You can't get around that because all of its funding is COVID-19 funding. So even if, you know, we as Eide Bailly audited the Coronavirus Relief Fund last year and there were no findings and everything was good and it looked good, if you have the CRF on your CFA again this year, it's going to be audited. It's deemed higher risk. And again, the COVID-19 funding would be material. Research and development is excluded from the above requirements. There's a lot of different grants and a lot of different things that go into R&D. So R&D is treated as normal. So again, maybe big picture, if you have a higher risk program, more likely than not that it will be audited. So what does the higher risk programs mean for type B? So for those of you that have smaller CFAs under $30 million, then a type B program is under 750,000. So if you got one of those programs under 750,000 on your CFA, there's only a small change. The auditor has always been required to risk assess type B programs. And what we do is we rotate Bs, or we replace those low risk larger programs, type As, with type B programs. We risk assess them, and maybe they get audited once every 10 years or 8 or 5 or whatever it is, but it's based on risk. So the only requirement with a higher risk designation is that we consider that in our assessment, but it doesn't require us to designate that program as high risk. And it's just one of several criteria that is used in that risk assessment. So, where your auditors will go, or where Bailey will go, that will be on a case-by-case basis. If you have a type B higher risk program, I can give my judgment and my opinion. I'm assuming that there will be a higher iteration of those audits at a type B level, but again, not necessarily required. So the largest COVID-19 programs, and the ones that have really gotten most of the media attention, most of the buzz, whether you're in an education setting or a state and local government setting that's not a school district, or at a nonprofit level and healthcare level, obviously with provider relief funds. But the largest programs are the Coronavirus State and Local Fiscal Recovery Fund. This was $350 billion. It is managed by Treasury. This is an American Rescue Plan Act program. It's not in the current compliance supplement. We fully expect it to be in the addendum, but there will be quite a lot of auditing over this over the next year, a lot of questions. There's already a bunch of FAQs. The final rule is not even out yet. I know I told my clients to take their time with this money. So most of my clients personally did not expend any funds by June 30th of 2021. But if you have a September year end, or October or December or whichever, then likely these will be needing to be audited because it's such a big program. Education Stabilization Fund was $278 billion. That's under, of course, education, and that's assistance listing 84.425. There's a lot of sub-programs here. It's split out between elementary and supplementary education and higher education. Lots of different, there's like a HERF 1, an ESSER 1, a 2, a 3, because they came out with subsequent legislation after the CARES Act that added more money to this. Education Stabilization Fund is actually quite complex. It's quite hard on the auditors and the auditees because of all the different sub-programs, all the different requirements. There's an FAQ for each sub-program. We'll go over some of the higher level items on them, and especially in the challenges, but be aware that that's out there. Provider Relief Fund, $175 billion. That is administered by Health and Human Services. It's assistance listing 93.498. Joy will speak more on this, but just from my perspective, probably one of the hardest or most frustrating grant programs, because it introduced a concept called lost revenue, which really didn't exist in the single audit realm before it, caused a lot of questions. There's a lot of money that went to for-profit healthcare entities, to nonprofit healthcare entities, to governmental healthcare entities, and just lots of questions, lots of challenges. The guidance has been changing. It was supposed to be audited last year, but it was so unclear and so many questions that they deferred it and delayed it. Well, now the cycle has come around, and now it's required to be audited. Joy will cover this in detail a little bit later in the presentation. Coronavirus Relief Fund, CRF, that's $150 billion. So you'll notice the big one in the governmental world, and yes, I live in the governmental world most of the time. CRF was 150 billion, and that's gotten so much press and coverage and everything else. The Coronavirus State and Local Fiscal Recovery Fund is more than double the size of the CRF, more than double. And so everything that we experienced as part of the CRF expected under the American Rescue Plan Act version of it, because it's really a similar program just under the new legislation. Okay, Education Stabilization Fund. So not to get mixed up in acronyms and if I speak in acronyms, the single audit world, the federal world is filled with acronyms, and sometimes it gets hard to keep track of them all. So the K through 12 entities, they receive the funding under the subprogram ESSER, which is essentially the elementary and supplementary education section of it. And then the colleges receive funding under HERF, which is higher education. They're both under 84.425. So that's the assistance listing, because that's the Education Stabilization Fund, but they broke them out into two basically big subcomponents. There are 3 different tranches for HERF 1, 2, and 3. The same approach, this was audited as part of the 2020 compliance supplement and audit. Same approach in the 2021 compliance supplement. So they have section 1 and section 2, which is essentially just splitting out ESSER and HERF. But in section 1, they've got 84.425A, C, D, H, and R. In section 2, they have 84.425E, F, J, K, L, et cetera, et cetera. Essentially, they're taking K through 12 and they're taking higher education. They're taking the various programs underneath that, and they're splitting the requirements up. Now, at a school district level, at a charter school level, at a college or university or system level, you'll probably just either have to worry about section 1 or section 2 because you'll be in your kind of lane. Now, if you're auditing a state or you're a state agency, you'll have to worry about both, right? Because you'll have higher education stuff, you'll have elementary and supplementary education stuff. And so state levels kind of have to worry about both. Elementary schools, K through 12, worry about one section, higher ed, worry about the other section. Now, you'll notice that there are letters in there that aren't listed in section 1 and 2, and there's a lot, right? All the way up through W and Y. It's like, how many sub-programs did education need to come up with this? But B, G, P, V, W, and Y are not included in the compliance supplement. And so those are evaluated using Part 7 criteria. Part 7 has been around for a long, long time. You basically use auditor's judgment to come up with the requirements that are direct to material, and you test to those requirements based off grant awards and other agency guidance. The sub-programs do matter. On the scheduled expenditures of federal awards, you total 84.425, so it's considered one program for major program determination, but you do have to identify the sub-programs, and auditors need to test the sub-programs to their various requirements. So it's a lot. It's going to be a huge challenge. You can imagine with all those letters, I didn't count them all, but up to Y, what is that, 25 or 24 letters? So just a lot to go through. Now, section 1, that was updated. That very long acronym there is essentially the Supplemental Appropriations Act. It was updated for the Supplemental Appropriations Act, but not for the American Rescue Plan. So the addendum that we're all waiting on, that we don't know when's going to come, will include updates for section 1 for the American Rescue Plan parts of the funding. Hopefully I didn't make that too insanely confusing for everyone listening. If you have questions, please ask them. I'll try to clarify, but there's a lot going on in the education world. So what changed? As I mentioned, the Education Stabilization Fund was in the prior year's compliance supplement. It was added through an addendum, but it was there. They did add the impact of ESSER 2, Gear 2, and E8 and S throughout. Now, again, Gear is like the governmental or the governor's section. ESSER is kind of that big tranche that everybody is familiar with. They added the annual reporting requirement to the reporting for ESSER 1 and 2, and they added 2 special tests and provisions. Participation of private school children, which, you know, if you're familiar with Title I, that and special education, those big education programs, that's always been a kind of a cross-cutting requirement across all education programs. They added it to the Stabilization Fund, essentially requiring entities to allow for the option for private schools to participate in the program. So, you know, if you're a school district, you can't exclude private schools, you have to give them the opportunity to participate. And then they also added prioritization services or assistance for non-public schools under emergency assistance to non-public schools program. So there's a special test for that as well. You know, what can I say about education stabilization other than there's just a lot to look at. There's a lot of sub-programs, a lot of FAQs. It will be a challenge. There'll be a lot of questions from auditors. Section 2 changes. They updated for each tranche of HERF. So you had HERF 2, which is the Supplemental Appropriations Act. You did have HERF 3 under the American Rescue Plan. An addendum is not expected for Section 2. Again, how complicated and confusing can it be? The addendum is expected for the ESSER side, the elementary and secondary education side, but for higher education, an addendum is not expected. They added a lot of information and changed wordings on allowable costs, earmarking, period performance reporting. If you are a higher education entity or you received HERF dollars or you're an auditor that's auditing higher education, you need to read in detail, in extreme detail, all the changes and the requirements under Section 2 of the Stabilization Fund. The CRF or Coronavirus Relief Fund, they did clear up and updated in the compliance supplement the extension that was a result of the Supplemental Appropriations Act. They also added that extra day, which was nice. The CARES Act originally had it as December 30th of 2020, and the Supplemental Appropriations Act went to December 31st of 2021. Unfortunately, that decision was made, I think, on December 27th of 2020, I want to say. So most entities had already spent all their money because they only had 3 days left. But for those that didn't, or those that changed their spending plan that quickly or within those final days, that was extended up through December 31st of 2021. They did update references from the FAQs to the newer Federal Register notice. So what happened was, for those of you familiar with the CRF, is they published a bunch of FAQs and they changed a lot, but they eventually got to kind of a final form of the FAQs, and then they consolidated those and actually adopted those into the Federal Register. So now you can't even find the links to those old FAQs. You're given a link straight to the Federal Register, which is essentially a copy paste of all those FAQs that were previously published. Thankfully, it did clarify in this compliance supplement, and it's a requirement that I'm going to go over later in the presentation, but it did clarify that FFATA reporting does not apply. For those of you that don't know what FFATA is, that's essentially the Transparency Act reporting, where you report pass-through dollars. If you're a federal contractor, you report subcontract dollars, but for everybody listening here, you essentially report pass-through dollars into a subaward reporting portal. We'll go over it in detail in a few minutes. So don't worry too much if you're unfamiliar with FFATA. So now I'll turn it over to Joy to talk about provider relief and some of the other healthcare programs.
Okay, thanks, Kurt. So Provider Relief Fund. So this went primarily to healthcare entities, either long-term care, acute hospitals, critical access hospitals, but we've also had some of our nonprofit clients receive some of the Provider Relief Fund money. Hopefully everyone is aware that the timing of the CFA inclusion has changed. And I'm going to walk through that with you. But this Provider Relief Fund has been a challenge for our firm. We have a team of people that are continuing to monitor the guidance. It continues to change. There were new frequently asked questions last week. There was a 60-day grace period last week on their reporting deadline, which I'll cover here too. But really challenging for both the recipients as far as understanding what they can or can't use the money for. And then this lost revenue concept, I think, has been really cleared up with the reporting portal instructions, but just a challenging program overall. So we're taking a step back to the 2020 Compliance Supplement Addendum. And in that addendum, it indicated that the Provider Relief Fund was to begin being reported on the CFA effective with December 31, 2020 year ends, and then later fiscal year ends. And now that the 2021 compliance is released, that guidance is now superseded, and it is saying HHS issued a frequently asked questions indicating that the 2021 compliance supplement does supersede the 2020 compliance supplement addendum as far as timing of when provider relief funds need to be on your CFA. So if you're holding up your single audit and you're at December 31 of 2020, you can remove the provider relief money from your CFA and go ahead and finish your single audit because it is not, should not be included on the schedule of expenditures. So they also included specific key line items that should be tested relating to reporting. So HHS has this reporting portal, and the deadline was indicated to be September 30 for all money that was received by June 30 of 2020. And we'll talk more on that here shortly. And so they have indicated key line items that the auditor is required to test, outlined in the reporting section of the compliance supplement. Another key change and another challenging area is in the special test and provisions area. So if you looked at the addendum, the special test and provisions was no last year. They've changed that to yes. And there's now a new special test and provision relating to testing the billing of out-of-network patients if they're either COVID patients or presumptive COVID patients. So the challenge that we've been working with on our revenue cycle people is trying to identify how to get our population selected to even do this test. So through the CPT code, we can obviously identify COVID or presumptive COVID patients, But then to drill down even further from that population to only identify out-of-network patients is really the challenge. And so we're hoping to get further clarification and guidance on how they would suggest that we do that. Also, once you do identify an out-of-patient or out-of-network patient, then determining what their billing should have been versus what they were billed is also very challenging because of the number of insurance carriers. One thing I do want to emphasize, and I know for the auditors and the accountants, we're very programmed to want to make sure that the revenue that we're recognizing for the financial statement agrees to the revenue or the expenditures that we're reporting on the CFA. Well, with the Provider Relief Fund guidance, you need to disconnect the two. They are two separate things. The revenue recognition on your financial statement audit needs to be based on revenue recognition principles relating to your fiscal year. It needs to follow your fiscal year end. What you report on your CFA needs to follow the chart in front of you. So if you have a year end that's before June 30 of 2021, can't emphasize this enough, you are not to report any provider relief money on your CFA. If your year end is June 30 of 2021 through December 30 of 2021, what you report on your CFA is going to mirror what you claim on your HHS Provider Relief Fund reporting portal for period 1 for both total expenditures and lost revenue. So you need to complete the reporting portal reporting first before your auditors can even really start on your single audit, because that's what drives what our population is. And period 1 is defined as payments that have been received from April 10th of 2020 to June 30 of 2020. So we almost have an entire 1 year look back. So the money that you got prior to June 30 of 20, how much of that did you expend and or claim as lost revenue? That's the number that goes on your CFA if you're a June 30, 21 fiscal year end. Then moving on to December 31 of 2021 through June 29 of 22. That same concept is going to apply, but now you've reported to HHS both period 1 and period 2. So you're going to add period 1 and period 2 together. Whatever you submitted on the reporting portal, that is what's going to go on your CFA. That is what the auditors are going to be testing. So period 2 is defined as July 1 of 2020 through December 31 of 2020. If you have a reporting period after June 30 of 2022, we're going to be looking to the 2022 compliance supplement for guidance. So Kurt, if you want to move on to the next slide. So initially this period 1 reporting was due on September 30 of 2021. That is really still the official due date. However, HHS has acknowledged, due to COVID surges reoccurring, that they are going to grant a 60-day grace period. They are, however, strongly encouraging you to file by the deadline, but acknowledge that might not be feasible or possible in some cases. The grace period does only apply to the reporting period 1, and it's going to get you from October 1 through November 30 of 2021. Unused funds. So if you've received funds prior to June 30 of 2020 and you don't have expenditures or lost revenue that covers the amount that you received, those unused funds should be returned to HHS as soon as possible after you complete the reporting submission. However, they need to be reported no later than December 31 of 2021. So that is what we're going to cover on the Provider Relief Fund. Another challenging program that was also included in last year's compliance addendum is the HRSA COVID-19 uninsured program, or financial listing number 93.461, which is also identified as higher risk. Again, in the matrix, if you would look at last year, the special test and provisions was indicated as a no, meaning auditors were not required to test. This year it is changed to a yes, and there is a new compliance requirement relating again to testing what was billed for uninsured, or if uninsured were billed. The challenge with this program is determining the dollar amount that goes on the CFA. There has been guidance indicating that that should follow your basis of accounting. So if you're accrual basis, they're saying use accrual basis for the dollar amount that goes on the CFA. However, the claims are submitted and then processed, and so you would need to determine the date of service and figure out on an accrual basis what was submitted for reimbursement. However, the dollar amount is still unclear. Again, we're hoping to get clarification whether that should be reported at the net amount that was reimbursed. Should it be the billed amount, or should it be some kind of value of the service that was provided? So again, hoping to get additional clarification on that. Kurt's mentioned the Medicaid cluster a couple times. That is also identified as higher risk. As Kurt said, always has been a higher risk. They have added some guidance on COVID flexibilities. The big one that's consistent, it's kind of a state by state determination, but the big one that's consistent is that there's a requirement for continuous enrollment. You can't lower a person's tier of coverage unless very specific criteria are met. They have added some clarification or information on allowable costs. And then the special tests and provisions have changed fairly significantly. There's 3 new special tests. So this is mostly important if you are a state or auditor of a state. And so I would encourage you to review this section of the Medicaid cluster in great detail. And with that, Kurt, going to cover some uniform guidance changes.
Perfect, and thank you for that, Joy. Okay, so uniform guidance changes. We had a webinar, I want to say a year ago, roughly, where we talked about uniform guidance changes. It's been out there now. People understand that uniform guidance really has a kind of a change period every 5 years. The feds take a look at uniform guidance and make any necessary updates and go through that process. Well, we're starting now because as Joy mentioned earlier, you know, those effective dates of the uniform guidance changes are starting to impact our audits. So there was an 8/13/20 date for telecommunications, and there is an 11/12/20 date for basically the other items. Now, I'll briefly cover what some of these were, but the telecommunications effective date, no political statement here, but this is when former President Trump was having arguments with China and accusing them of spying through telecommunications and everything else. So they adopted in uniform guidance essentially a list of, for lack of a better word, debarred parties, companies from China that you are not allowed to do business with. The challenge with that is it's not always clear of whether or not the telecommunications equipment that your agency buys, your telephones, your security systems, etc., whether that's made or from a company in China. You probably get them obviously from a local supplier, but trying to figure out if that's supplied from one of these debarred Chinese companies is a challenge. Regardless, that became effective 8/13/20. Significant challenge for auditors to look at, because let's be honest, a CPA accountant trying to ask a controller of a company if they know if their telephones are purchased from one of these 3 Chinese suppliers is kind of going down a rabbit hole, right? Trying to figure that out. 11/12/20 was the date for a lot of the other items. The big ones there, or probably the biggest one there, was procurement policy changes and a lot of changes to the micro purchase level. That became effective 11/12/20. So I got a lot of questions from clients saying, can they change the procurement policies now? It's effective. Let's move on from the old and bring in the new. Well, yes and no. The hard part is uniform guidance, which is 2 CFR 200, technically has to be adopted and codified by each federal agency, right? So it's written into federal regulation in 2 CFR 200, but defense, energy, education, health and human services, all of them have to adopt and codify it in each federal agency's code. Well, that doesn't sound like too bad if everybody does it. Unfortunately, these major agencies, as you can see on the screen here, defense, energy, and the big one in red and bold there, health and human services, interior, and transportation, they have not yet adopted uniform guidance changes from the last iteration. So we'll talk about FFATA in just a minute. The new FFATA updated threshold of $30,000. If you are reporting in one of those agencies, that updated threshold doesn't apply to you. If you updated your procurement policies for the new micro purchase thresholds and allowances that were provided in the uniform guidance changes, those do not apply to you if your grant is in one of those agencies. And so what's hard and what happens is what if you're an agency that has an HHS grant and an education grant? Education has adopted, health and human services has not. You want one procurement policy, but the new micro purchase thresholds are allowable for your education grants, but not for your HHS grants because it hasn't been adopted. So that creates, inconsistency and it just makes that very confusing for everyone involved. And so kind of from a procurement standpoint, you need to take the most restrictive, right? You would err on the side of caution. So you probably wouldn't make any changes if you had grants in both agencies. If your agencies have adopted and you don't have grants in the other federal agencies, then fine, go ahead and make your changes. And if you only have, procurement in the federal agencies that haven't adopted, then you can't really do anything yet. The list is published for the auditors in the room. If you don't believe me or you want to look at your own compliance supplement and cross-reference, it is published in Appendix 2. There is some asterisks and some supplemental information that's provided to give you some background, but those are the major agencies right there that have not adopted. As far as timing and when it's expected to be adopted, nobody knows. I mean, the federal agencies have a lot going on, right, with COVID-19 and all the new legislation, CARES Act and American Rescue Plan and the Supplemental Appropriations Act. And, anybody that's been paying attention to Capitol Hill, we've got infrastructure potentially coming. So when these major federal agencies get to adopting uniform guidance, unfortunately, I don't have an estimated timeline for you there. Okay, FFATA reporting. This is Transparency Act. If anybody remembers the Transparency Act and the reporting, this has been around since 2010. Auditors had to test it way back when. I remember testing it, roughly a decade ago. And essentially, I remember the portal being down. Nobody could report anything half the time. It was basically non-functional. The public-facing website is usaspending.gov, if any of you've heard of that. And essentially, it was broken. And auditors tried to test it for, I want to say 2, maybe 3 years. And we just had a finding at basically every agency. It was a mess. OMB took the requirement away from auditors, not from auditees. So it's always been around. Auditees have always had to comply. They've always had to report this, but they said auditors were being inundated with Transparency Act reporting findings. It's mainly because the portal's taken down. We know it's a giant mess. We know it's a disaster. You don't need to look at it. Well, now several years have passed, half a decade has passed since then, and the feds are saying, okay, we think all of that stuff has been ironed out. They should have been reporting for a while now. It shouldn't be a surprise to anyone. Now, auditors, you have to test FFATA. So that has been incorporated into the compliance supplement. Transparency Act reporting generally applies if in part 2 of the compliance matrix, reporting is marked as yes, and the auditor determines that reporting is direct and material. And then the recipient makes first tier subawards. The subcontract piece is for federal contractors. So if you're auditing a federal contractor that has a cost reimbursement contract under FAR and they do subcontracts, yes, that applies to you too. I'm going to assume that 99% of the participants on the call are in that first bucket of making first tier subawards, or maybe you don't even have subrecipients. And if you don't, you get to ignore this. But essentially, if reporting is direct material and you have pass-through payments and your awards to those subrecipients are either $25,000 or $30,000, the difference is in the agencies that have adopted the uniform guidance changes that I just talked about on the previous slide. So if you're HHS, it's still $25,000. If you're education, it's $30,000. Again, I know it's confusing. I wish everything was consistent, but unfortunately, that's just not how our government works. So and it can be cumulative as well. So if I'm passing through to, city A, and I do a $20,000 subaward, and then I do an amendment for an additional $11,000, I'm now at $31,000. That would trigger a reporting condition, and you would have to report that in the FSRS, which is the reporting system for Transparency Act reporting. I mentioned earlier, Coronavirus Relief Fund, CRF, is exempt from the FFATA reporting, even though Part 2 is marked as yes. The reporting requirement under CRF is their grant solutions. Anybody who's been involved in that is like extensive reporting, and that does not need to be included or tested under Transparency Act. There are key data elements of Transparency Act reporting, the ones that we're required to look at as auditors. You have the subawardee name, the DUNS number, the amount of the subaward, the obligation date, date of the reporting submission, subaward number, project description, and then subawardee names of highly compensated officers. Now, The hard part on this, and a challenge from an auditor perspective, is some of these items are viewable on usaspending.gov and some are not. Most of the, like the subawardee name, DUNS number, that stuff you can see on usaspending.gov. You're required to search for those. The date of the report submission is not, though. And so you have to work with the auditee. And so the auditees that are listening, we have to essentially have you log in and then either do screenshots or a screen share or something to show that reporting date, because there is a timeliness requirement with Transparency Act reporting. It essentially has to be reported in the month following your obligation. So if you passed through funds in July of 2021, they have to be reported in the FSRS by the end of August 2021. So you have that 1 month following your obligation. And we have to somehow do a screen share or a screenshot, which with all the virtual and remote working we've been doing, hopefully everybody's relatively confident in now. But we do have to report on timeliness. I do get questions on what do we do about highly compensated officers and what does that even mean? Thankfully, most of the time it's not applicable, but here is essentially the requirement for reporting on highly compensated officers. The pass-through entity, so the state or the county or whomever's passing through the funds, you have to report the names and compensation. It's kind of like an SEC requirement for the subrecipient's 5 most highly compensated executives. If, this is just, here's the big if, 80% of the prior year annual gross revenues are from federal financial assistance, and they have 25 million in gross revenues, and the public does not have access to that information already through various SEC reporting. So if you think about it, you have to report the highly compensated officers if they get over $25 million in federal awards or federal procurement contracts, and that 25 million or higher makes up at least 80% of their total revenues. Now, in a government world, you're passing through to a county or to a city or to a school district. Those counties, school districts, other governments, they have a ton of taxes and charges for services and other fees that likely make it so that they would never ever meet this 80% criteria. In the nonprofit world, $25 million in annual gross revenues just from federal grants and federal procurement contracts is a lot. So I would imagine that there's not a whole lot of nonprofits that are getting over 25 million in federal revenues. Again, it could happen, but I see this as usually not applicable. Somebody can correct me if I'm wrong or throw some scenarios out there. I'm sure there are some that exist, but I just think for the most part, not applicable.
Okay, I think we're gonna cover Appendix 7 next. And Appendix 7 is really a very important appendix. It's kind of a catch-all or a hodgepodge of various different topics that didn't really fit in any other of the parts or appendixes. So I'm going to cover the 6-month extension of when your single audit is due first. So in March, I believe it came out that they were granting. Last year, we had a 3-month extension. In March, it said if you had not submitted your audits on March 19th of 2021 through June 30 of 2021 year ends, you now get a 6-month extension. And this is broader than the previous 3-month extension. The 3-month extension required you to have received COVID-19 funding. Now it is basically a blanket extension. However, they are requiring you to internally document why you need or why you felt there wasn't a need for this 6-month extension. The federal agency doesn't need to approve it. You don't need to ask for approval, but you do need to document why you believe you needed the 6-month extension. We are aware of the fact that we believe there's going to be a bottleneck of single audits happening for those individuals that have to wait for their single audit to get completed due to waiting for clarifying guidance or various other reasons, changes in personnel. So our recommendation is not to delay getting your single audit done unless you absolutely have to. So as a reminder, the normal due date is 9 months after your fiscal year end, with a 6-month extension that gets you to 15 months after your fiscal year end. So if you have not yet completed your June 30, 2020 single audit, you need to have that done by September 30 of 2021. And likewise for June 30 of 2021, you will have until next September 30th to get your single audit done and filed. But again, strongly encourage you to get it done if you can get it done. COVID-19 also added a new footnote disclosure to your schedule of federal expenditures on donated protective personal equipment, not to be confused with property, plant, and equipment. So donated PP&E should be disclosed if it's not already included on the CFA under an assistance listing number. Donated PP&E has always been required to be shown on the CFA at its fair value if there is a assistance listing number connected with it. But this is just adding clarifying guidance. They realized that entities were receiving federally donated or pass through from a federal source donated PPE that might not have been tied in with an assistance listing number. So to the best of your ability, estimate what that was. The auditors are not required to audit that number. It's simply a disclosure. Also important in Appendix 7 is a reference or clarification on the frequently asked questions. So frequently asked questions have been released since the start of COVID, trying to provide interpretative guidance to both recipients and auditors, or add clarity to what the intent of the regulations are. In Appendix 7, they talk about this, and really the intent of those frequently asked questions was not to create new compliance requirements. The auditors are required to test to the terms and conditions of the grant agreement, the federal statutes, the regulations, and that is the basis for our finding. And that should be what the finding is based upon. They also acknowledge that the regulations or the guidance has continued to evolve. And so if a recipient had an expenditure and they were basing the expenditure on the guidance that existed at the time, which then later subsequently changed, as long as they have documentation as to why they believe that expenditure was allowable at the time, then that would not require that to be reported as a finding. The auditor would evaluate the recipient's documentation and their position and make their judgment based on that. So they are acknowledging the fact that we are really being asked to audit a moving target. And so I would encourage you to read through that section in Appendix 7. Similar to the prior year, they have indicated that they do want the COVID-19 designation shown on the face of the CFA. So that requirement still continues. They have also provided clarifying guidance on the data collection form. So within the data collection form, that was also required to be disclosed last year. They now want the COVID-19 designation in column C, so they've addressed or provided clarification on how best to report that within the data collection form. They also, if the auditors have a finding, in the heading of the finding, they want the COVID-19 designation in the heading of the finding itself. And Kurt hit on this prior, but those sub-program letters for ESSER or GEAR, those should also be included on the CFA. So the sub letters are very important. They also need to be shown on the data collection form.
Okay, so kind of to wrap up here in the next 12 minutes or so, and we're going to try and leave some time for Q&A, and I know there's 3 questions in the Q&A, and we'll try to get those right before we finish up. One quick clarification on just the previous slide for the donated PPE. Auditors aren't required to audit that as part of, the CFA and as part of the single audit. It is a disclosure. There are financial audit considerations though, and whether that PPE is in inventory or if there's any, non-cash revenue and pass-through and stuff. So auditors will still look at PPE, but just not in the context of necessarily the single audit or major program if it's not attached to an assistance listing. Single audit challenges. We've talked a lot about these already, but I'll kind of just highlight them as a reminder for everyone. So for the Education Stabilization Fund, you have to audit the entire fund in its entirety. So you can't pick and choose sub-programs. Now, you could do different auditing techniques like stratification of samples and stuff and considering what's material and not material. That's different, but you can't separate the sub-programs and do separate major program determination. You have to include all of that as one program and then audit and pull samples as appropriate as if it was one program, but you can obviously stratify and have different techniques for the sub-programs. Also, with education stabilization that I hit on, because there are so many sub-programs and there's section 1 and addendums coming out and a section 2 with no addendum, there's just a lot of confusion, a lot of guidance out there. If you look at that part of the compliance supplement, there's like an entire page of links to different FAQs. So trying to keep that all straight is a significant challenge. OIG's already noted issues with the 2020 audits. It's like, okay. So if you're an auditor, read very, very closely. If you're an auditee, hopefully you're well aware of all those FAQs and all that guidance. If you're not or have no idea where to find them, then you can actually look at it in the compliance supplement and click on all those links to all those FAQs and dog tag or favorite all the ones that are applicable to you. The Coronavirus Relief Fund, there was lots of changing guidance. We did have a lot of questions on what's a subrecipient versus a contractor versus a beneficiary. The CRF and really the FAQ introduced the concept of an organization can be a beneficiary. Previous to this, usually that was an individual type of concept. So organizations were either a subrecipient or a contractor. Under CRF, mainly because of all the lost revenue subsidies that were being provided to small businesses, they started thinking to themselves, okay, a small business that's getting revenue replacement because they were shut down due to the pandemic, lost revenue is not allowable as a subrecipient or as a prime recipient. But if you're providing an assistance program to the public, meaning the business owners, they could be a beneficiary. Lots of questions on that, lots of challenges, high level of documentation needed to support your position. And it's all judgment based. Provider relief funds, Joy talked about this a lot already, but delayed and changing guidance. What is reported on the CFA is completely different than when those expenditures were incurred. Period approach to portal reporting, lost revenue, for-profit audit guidance, all of the above, significant challenges. And then of course the 60-day grace period, even though it's not an extension. And then last but not least, what about programs that are going to be added to the addendum? We haven't even covered those yet, because we can only cover what's been released so far. For the COVID-19 programs, there's a lot of guidance that's been published on agency websites. It's not all in the compliance supplement, and not all COVID-19 programs are in the compliance supplement. So if you have one that's not in the compliance supplement, it's even a harder challenge and a harder risk, because you need to kind of go through the agency website and try to look at any FAQs or program guides or whatever guidance has been published. There can be a lot of modifications from the original terms and conditions, so you can't just rely on that original grant award. Again, we've already talked about the additional addendum coming up. This last caveat here is pretty important. So reports issued prior to the publication of agency audit guidance are not required to adhere to the requirements. So kind of like how Joy said, if you had an expenditure with the information at the time, that it's fine. Same with the auditors. If you're auditing the program with the information at the time, you're okay. The problem is there's so much guidance all over the place and on agency websites and various places that there's a really high risk that an auditor might miss a program letter, an FAQ, something, and you might miss a requirement. And it's unclear of whether that it's not really a safe harbor, but it's unclear of whether that comment in the compliance supplement would include agency guidance that's issued on their, public facing website, or through a memo that they sent to auditees, or whether or not they meant, hey, if you audit it and it's not in the compliance supplement yet, then you don't need to worry about. There's no real clarification on that. So our firm and most other firms and most peer firms are essentially waiting on the addendums before issuing audits that have, the expected applicable programs that we expect to have in the addendum. There's just too much risk. There's too much unknown. And when I say too much risk, there's just too much risk of missing something. We don't want to miss a requirement, an FAQ, some sort of guidance, a memo, whatever that is key, or at least directed material to the audit. And so we're holding off. If you have an ARP program that's going to be required to be audited, if you have, ESSER that we're expecting Section 1 changes, anything that's coming up in the addendum, we are pausing and won't issue those audits until the addendum and the compliance supplement comes out, because again, there's just too much unknown. So the addendum, at a minimum, is expected to include the capital projects fund. The assistance listing hasn't been assigned for that yet. Homeowners assistance, local assistance and tribal consistency fund, the state and local fiscal recovery fund, that's the big one under American Rescue Plan. Education Stabilization Part 1, so that's the ESSER side. Emergency rental assistance, again, not in there, not planned to be in there, but the AICPA is pushing for inclusion, and we have and there's been no word yet on yay or nay. No new clusters are expected, and the shuttered venue grant is not expected to be included in the upcoming addendum. These lessons learned from the prior year in CARES Act, we're running out of time, but we've talked a lot about this already. Essentially, our recommendation is to document the guidance you followed, include the dates, include descriptions or rationale. Really, the key part is documentation here. Document when, where, and why. And we'll go with that. We understand that there was a lot of judgment, a lot of change in requirements. So documentation is key. We expect many of those to carry over into the American Rescue Plan. The only nice part about that, at least for the state and local fiscal recovery funds, is that you have a little bit more time. You can obligate up until 2024 and then spend by 2026. So some time there. Have patience though, we're still waiting on a final rule. All the guidance isn't issued yet. Once the final rule is out, then we'll go from there. Okay, so really quickly, Joy, I think we have 2 minutes maybe to address questions.
Yeah, maybe one thing that I neglected to mention at the start is obviously this presentation was prepared based on information we know or to the best of our ability. The GAQC, which we rely heavily on, which is the Government Audit Quality Center through the AICPA, is having a lightning round webcast tomorrow. And so if something would come out clarifying guidance or something that we misspoke on, we would communicate that through an email or an insight or push something out on our website. If you found this presentation to be mind-boggling with the amount of information, it is because it is mind-boggling. Trying to do our best to keep up on things, but a lot of information. So Kurt, should we try to address the questions quick?
Yeah, I think we can address them pretty quick. And if you want the answer to your question, then you can stay on for a couple minutes. We won't go too late. So, and just in deference of time, let's just take them really quick. So the first question is, if a subrecipient omits or misstates expenditures from a pass-through entity on the CFA, what must the subrecipient do to address this? For example, should the subrecipient reissue the CFA if the omission of a statement is deemed significant, issue an addendum to include basically the correction, or issue a letter concluding that the omission or misstatement was not significant? So how I interpret that, essentially you're saying if a subrecipient misstated their expenditures, if they just didn't identify it as pass-through and they identified it as direct, then it's probably not material. But if they actually missed the grant award, then you would have to do the assessment, discuss with the auditors whether or not that had an impact on major program determination, if it was material to the CFA, and you'd have to follow standards from there of whether reissuance was necessary or not. Anything to add there, Joy?
No, I think that the entity passing through the funds has a responsibility to notify the subrecipient that it was missed, and then it's going to be a subrecipient and their auditor discussion. If the subrecipient chooses not to modify and you believe it's significant, then you should take that into consideration when you're doing your subrecipient risk assessment, that they're not following the terms of the grant agreement.
Okay, next question. If the CARES Act program funding is less than 25% of the type A threshold, am I correct that it would not need to be audited as a major program based on the amount despite the higher risk designation? So if it's less than 25% of type A, it's a B, and then it's actually a really small B that isn't required to be risk assessed. So again, B programs aren't, that's just one criteria. You don't have, it's not a presumptive have to audit it. So yeah, you would not have to audit it. You don't have to audit it if it's a B. It's just a risk assessment consideration. You only really have to audit it if it's an A, assuming it won't meet any of those allowable exemptions. So you're correct. Is the FFATA reporting submitted directly through the reporting system? So FFATA reporting is done by your first tier, your pass-through entity. They have a login that goes in, it's called the FSRS. It's the FFATA subaward reporting system. They have a login and then they report it on there, and then that is what feeds usaspending.gov. So it's reported through the FSRS. Should interest earned be included on the CFA for 21.019 and 21.027? I haven't looked at, so the 21.027 compliance supplement stuff isn't out, but 21.019 is exempt from the Cash Management Improvement Act. And so interest earnings are required to be included back in the fund, but you don't have to like send them back. If you spent that interest on the program, you would just include it in the CFA. I doubt that is, for those that got CRF and huge dollar amounts, the interest earnings probably are not significant enough either way to be material to your auditor, but they have those expenditures, then they should report that. Okay, not seeing any other questions. Thank you everyone for participating. We went 3 minutes over to answer some Q&A, but I think that's okay. And again, thank you everyone for your participation.
Thank you. Have a great day.